Hi, and welcome to the JoeyOffAir Podcast. And today feels very great because today is World Malaria Day. I have this interesting fellow, a change maker, and of course, you've seen the t shirt he's wearing, Block Malaria Africa. He's here to talk to us about malaria and climate change. Yeah, I think they are twin brothers because, of course, I know that one is eating another one. So, nice to have you on the podcast. Talk to us. What brought up the idea of commemorating World Malaria Day, and how significant is it considering this year's theme to Nigerians?
Okay, thank you so much, Joey. It's a pleasure to be on the show today, and of course, today being World Malaria Day is a very important day globally. And like you've asked, why is today very significant? Every single minute, a child dies from malaria somewhere in the world, and this is a very devastating statistics. You can see that in the next 2 minutes, for instance, we would have lost two children, most likely under the ages of 5, to the devastating impact of malaria. So the United Nations came together and selected 25th of April annually to be a day marked as World Malaria Day. The aim of this particular day or this particular event is to be able to generate more conversation around how malaria can be eliminated or combated across different parts of the world. So it's a very significant day, and today every aspect of every part of healthcare, or every part of government, in different part of the world, is actually working actively to discuss more on how innovative approaches can be brought in to help combat malaria in their countries, especially in endemic countries. So World Malaria Day is also another day that is used to mobilize funds for malaria elimination and control in country and then across the African continent and across the world generally. So basically the day is marked so that we can be able to identify we can be able to recognize malaria as a devastating disease, and then create avenues to end it.
So, talk to us. You said something that is very important, talking about elimination of malaria. Is it possible to eliminate malaria from Africa?
It is very possible. By the way, malaria can actually be eliminated. Malaria can actually be combated, completely eradicated from a nation and even from the continent. Countries like the US and amongst other countries in Europe, Germany, Russia, we used to be malaria endemic at some point, and just to bring the matter down to Africa, somebody once asked me this same question in the past: is it possible for Nigeria to eliminate malaria? And then he also asked, is it possible for Africa to eliminate malaria? And I said yes. In the year 2018, Algeria was declared malaria free by the WHO. And for a country to be able to meet that criteria, to be declared zero malaria or malaria free, the country ought to have reported zero malaria cases across 4 years, right? What that means is that the country would have been able to, identify, diagnose and treat, every malaria cases in their country, and then maintain that record more like a clean sheet, right? From football angle for the next 4 years. So, and just recently in 2024, to interest you to note that Cape Verde, right, or Cabo Verde, also achieved zero malaria. Yes, that's a country in Africa, by the way, it's an island, right? So it's a country in Africa. It achieved zero malaria, and what that means is that from 2018, they recorded zero malaria cases. They reported zero malaria cases for 4 consecutive years, and they were declared malaria free in 2018, in 2024 rather, right? So Africa can eliminate malaria. We just need to put the right strategies in place. We just need to increase our domestic funding and political will towards combating malaria. And of course, we also need to leverage on our youth population. Now, Africa has about 60 to 70% of young people who are highly innovative, creating digital solutions to health-related issues and all that. We need to be able to harness the potentials of the young people in Africa and build their interest towards combating malaria. And once that happens, I strongly believe that we're going to have more countries in Africa, eliminate malaria. So we have Cape Verde, we all have Algeria, And of course, we have countries like Botswana who are currently in the E2025 initiative that are working strategically towards achieving zero malaria in their country. So I think it's possible. And even for Nigeria, we can make it possible, but then a lot is required. And we're going to discuss that most likely.
So for some certain persons like my grandma or my granddad that doesn't really know what malaria is, how would you describe malaria to that man sitting next door and to that woman that doesn't really understand what malaria is? What she understands is, sometimes she gets fever and she has some blisters, and then so what is malaria? And what are like the signs and symptoms you can use to identify malaria?
Okay, so malaria is a life-threatening illness, that is caused by the bite of an infected female Anopheles mosquito. And when we say a disease or an illness is life-threatening, it means that we're saying that these diseases have the ability to kill. We say this disease can actually bring about death of a person, right? So that is what malaria is. It's a life-threatening illness, and it is caused by the bite of an infected female Anopheles mosquito. Somebody once asked me, how do you know the infected and an infected and an uninfected female Anopheles mosquito? And then how do you differentiate between a male Anopheles mosquito and a female Anopheles mosquito? And the shortest point I could share at that point was, it doesn't matter whether the mosquito is male or is female. It doesn't matter whether it is infected or not infected, because you can't actually detect that. If you can avoid mosquito bites, you can avoid malaria. Right? So avoid mosquito bite, you have succeeded in avoiding malaria, right? Now, malaria actually have numerous symptoms and it manifests differently in different people, right? So usually I'm not of the opinion that there's a particular signs and symptoms that cause malaria, but we have some general signs and symptoms that is associated with the disease. But because malaria share a lot of symptoms with several other diseases, it is actually not wise to say this is the exact symptoms that malaria presents with. But some individuals have presented with vomiting, with nausea, with headaches, with chills like fever, and in severe malaria cases, some persons have also presented, like babies have presented with jaundice, right? And they've also presented with we've also had adults present with severe headaches, right? We've also had them present with severe dizziness, and even bloody urine in some instances, right? Yeah, so when malaria is severe, it could actually bring about death, and then some of these intensified symptoms can actually be seen at that point. So malaria is life-threatening, and then malaria signs and symptoms cannot be generalized, and it is one of the reasons why we highly recommend that you get tested. Once you see these signs that we've talked about and others, go to the hospital or go to the nearest clinic, get tested, and be sure, so that we can be sure that what you have is malaria before you get treatment. Because sometimes the symptoms of other illnesses can present like these same symptoms we've discussed. And when you start taking malaria medication that is not prescribed, that is prescribed without proper diagnosis, then you may be taking a medication that is not attending to an illness that you have at that point. So you may have, for instance, typhoid. You may, for instance, have maybe fever emanating from maybe food poisoning or something, and then because you're having fever, you think it's malaria, and you go about taking anti-malaria. All drugs are poisons. So if you're not sure, don't take the medication. Go get tested when you have symptoms. Be sure that it's malaria before you get prescription, and then when you get this prescription, complete your medication. Don't stop when you start feeling well, right? Complete your medication. It's one of those things that Nigerians do a lot.
Yeah. So let's talk about the relationship of climate change and malaria. I know they're like cousins or brothers and sisters, but I'd like you to just throw more light. What's the relationship between malaria and climate change? And of course, what is the impact of malaria in Africa?
Okay, so yeah, I totally agree with you that both that malaria and climate change have a relationship. Yeah, that's very true, and this is how it relates, right? The vector that transmits malaria, which is mosquito, right? Is of course, malaria is a vector-borne disease, right? Mosquito is an insect, right? That is favored, which transmission or growth is favored by certain kind of atmospheric condition or weather, right? Now, when we're talking about climate change, basically, we're talking about the change in atmospheric condition that brings about increased heat condition or heat waves, that brings about increased or low rainfall, that brings about drought, you understand, that basically affects the normal atmospheric condition of a place, right? Now, how this affects malaria, or how this impacts malaria basically, is that as a result of increased climatic condition, we're beginning to have increased rainfall in certain region. In some region, we're also beginning to have decreased rainfall. We're also beginning to experience some natural disasters like drought, like earthquakes, like famine in certain countries. For instance, even in Pakistan, for instance, the World Malaria Day report in 2023 that was released by the WHO in November was pointing out that, for instance, in Pakistan, as a result of flooding, increased flooding that is caused by extreme climate conditions, malaria cases in this country spiked by over 5 times. 5 times. So Pakistan recorded 500,000 deaths, to malaria. 500,000 cases to malaria, but then eventually, after flooding, a lot of flooding event caused by climatic condition that they experienced within 2022, down 2023, the cases skyrocketed to 2.6 million, right? That's about 5 times the number of the impact of malaria in their country. And even in Nigeria, for instance, we had the same thing happen. Nigeria recorded an increase in malaria cases by over 2 point something million cases, right? So that's quite a lot, right? So as a result of increased climatic condition, like worse climatic condition, these mosquitoes are beginning to move from regions that have already been declared that are endemic to malaria, to regions that have been declared malaria free, right? Because certain regions are already used to certain temperatures and weather condition, and all of a sudden, because of climate change, these weather conditions are changing to, they are beginning to get more comfortable for these mosquitoes to dwell in that particular environment. So, and once you have mosquitoes around, then the tendencies for malaria to increase in transmission is very, very high, right? So now we're beginning to have high malaria transmission even in non-malaria transmission seasons, right? Meaning there's a season, of course, where we expect malaria cases to be high because we know that there's heat and then the weather condition will permit for more mosquitoes, right? But then there's also a season where we expect low transmission because we don't expect mosquitoes to be all over the place. But because of climate change, right now we're not able to we don't even know when is high transmission season and when is low transmission season, right? So the impact of malaria in Africa is massive. Is massive. Africa as a continent records about 95% of the global malaria cases, right? And about 94% or so of the global malaria death. In Africa alone, 4 countries, I think 4 or 5 countries in Africa contribute to more than half of the global malaria deaths, right? The World Malaria Day report in 2023 was pointing out that Nigeria recorded about 31% of the global malaria death. 31%. Right, that's a lot, right? If you look at the statistics we have, we are looking about 580,000 deaths from malaria in 2022, right? And then Nigeria contributing about 31% of that figure means Nigeria was recording about 180 something thousand deaths to malaria. So we don't feel the impact of these things, like Nigerians don't take it, so we're not aggressive about it, because if you look at a population of 220 million people in estimate, if 180,000 are dying, it's almost as though it's insignificant to the figure. And because they are dying in different locations, we are unable to, except for somebody who have lost a friend, a cousin, a sibling, to malaria. Sometimes when you tell people that malaria kills, they don't even believe it, right? but look at the data we're seeing, right? Look at what the data is showing, right? And it's quite unfortunate. I've lost friends to malaria. I've lost a couple of relatives to malaria, and it's part of the reasons why I'm very passionate about ending malaria, not just in Nigeria, but then in Africa, right? And the impact is just so massive.
Talk to us about how young people are shaping narratives and how they are contributing to ensure we have zero malaria in Africa.
Yeah, so like I rightly pointed out earlier on, Africa as a continent, has about, we're looking at about 60 to 70% of its population as young people. And we're talking about young people who are highly innovative, who are highly creative, who are energetic, who are passionate. There's this saying that when a young African, travels to Europe or travels to America, he or she does amazingly well and contributes, like they perform very exceptionally, right, in whatever setting they find themselves outside the continent. So that is to let you know how, what we call the power of the African youth, right? Young Africans are superhumans, right? And having about 60 to 70% of the entire population of the continent made up of these people. Yeah, we're talking about ourselves. So saying about 60 to 70% of the African continent, the population of the African continent making up of these young people is to say that we have what it takes to do anything we want to do, create any solution to any problem, no matter how big. I will shock you. Malaria is the number one killer disease in Africa. Yes, it's the number one killer disease. Show me another disease that kills a child every 1 minute. Right?
Yeah.
This is exactly what we're saying. So, at the ALMA Youth Advisory Council, the African Leaders Malaria Alliance Youth Advisory Council, which was formed in 2021 under the mandate of His Excellency President Uhuru Kenyatta, the former chairperson of ALMA. We are made up of 11 young people selected from different countries in Africa, and we're carefully selected to come as advisors, to help contribute towards the implementation of the ALMA Youth Strategy, right, which is a strategy document on, guiding young people's engagement in the fight against malaria across Africa. So our contribution towards the fight against malaria is just so diverse. Beyond implementing the youth strategy, we are also in the forefront of creating youth corps across all the countries in Africa. And so far, we've been able to establish over 40 youth corps across 40 countries in Africa. And we've been able to launch about 8 of this youth corps. And in total, we're looking at about 3,000 plus young people across the African continent who are deliberately contributing towards the fight against malaria in their respective countries, and particularly at community level. So we are already harnessing, the creativity and the innovations that young people bring to the table in terms of the fight against malaria. So this is really a very, very exciting opportunity, and then it's part of what we do. Yeah.
So talk to us about what you're doing at Block Malaria Africa and how you're using that as an instrument of reducing malaria in Africa.
Yeah, so Block Malaria Africa is a malaria intervention initiative, of course, that is based here in the city of Jos, Plateau State, Nigeria. And one of the key things that we do is actually to help community build resilience against malaria. One of the core focus of our work is around promoting awareness on malaria prevention. We believe that a disease that is preventable and treatable, like malaria, should not be allowed to kill one person. Nobody should die from malaria, especially because it's preventable. So if you can prevent the disease, then you don't even get the disease. Talk more of treating the disease, which is also expensive in nature, and then talk more of getting fatalities from the disease. So with respect to the World Malaria Day, we have quite a lot of activities that is planned. We just concluded a collaboration with the Nigerian Medical Laboratory Science Students Association at the national level, and we're going to be implementing malaria awareness campaigns across 10 universities in Nigeria. Last year, we got some very terrible news about 1 or 2 students that had passed as a result of malaria in a couple of higher institutions in this country. So we're hoping to be able to amplify the awareness on malaria prevention, how malaria can be prevented. We want to educate the students on the need to use bed net, to sleep under insecticide net, on the need to keep the environment clean, on the need to complete their malaria medication whenever it is prescribed. We want to educate them on the need for them to get tested whenever they come down with signs and symptoms of malaria. Basically, we want to help them understand that if they can avoid mosquito bites, then they would have succeeded in avoiding malaria, right? And that way they can stay stronger in school and they can be able to focus on their education, and then malaria will not be a reason for any of them to leave classes or skip their exams, like I once had as an experience. Right? Yeah, so basically that's it.
So, as we get this conversation to a closure, talk to us about this year's theme and how it's relevant to this time and season.
Okay, so the theme for the 2024 World Malaria Day is health equity, gender, and human rights. And the message around this theme is aimed at increasing awareness on the need to protect the rights of the most vulnerable population affected by malaria. We're talking about women, pregnant women. We're talking about children under the ages of 5. We're talking about communities that are most at risk to malaria that have not yet been, receiving malaria intervention. So the theme is basically around how can we protect the rights of women, pregnant women who are most at risk with malaria. How can we protect the rights of children under the ages of 5 who are most at risk of malaria? How do we ensure that the proper malaria intervention are channeled towards communities that are mostly affected by malaria? And again, an aspect of the theme is also talking about the need for us to prioritize, investment in malaria elimination. So through we have the RTS ASO1 vaccine that was produced by GSK. We approved in 2021 by the WHO, and most recently we also have the R21 matrix vaccine that have also been approved by the WHO and also been approved by the NAFDAC in Nigeria. So the conversation even around the theme as it pertains to Nigeria is how do we ensure that vulnerable populations, children within the age of 0 to 5 months, have access to this malaria vaccine that is currently available, that have the ability to prevent malaria death. The RTS ASO1 vaccine was said to have prevented malaria death to about 13%, in 2022 after its release. So how do we move from here, right? So we need to really prioritize, vulnerable population. We need to be able to ensure that the rights of people affected by malaria are prioritized. We need to ensure that communities that are most hit by malaria, or have the higher risk of coming down malaria, they are prioritized in terms of distribution of malaria intervention. And then we need to also strengthen our healthcare system. In Nigeria, one key message is for the government to be able to increase its political will towards ending malaria. We have the Nigerian End Malaria Council that was launched by President Muhammadu Buhari about a year ago or so, right? We need to be able to find a way to, work with the End Malaria Council and get them to increase domestic funding for malaria prevention. We also have the Nigerian Malaria Youth Corps that is yet to be launched but have been established by the African Leaders Malaria Alliance in Nigeria. We need to be able to have the Nigerian Malaria Control Program as well as the Ministry of Health support the launching of this youth corps so that more young people in Nigeria can venture into the fight against malaria and can bring on board their innovation, their experience towards ending malaria in Nigeria. I believe strongly that zero malaria is possible in Nigeria. It may not happen today, but I strongly believe that it will happen in my generation. So as a young person, I'm committed towards ending malaria. I am passionate about achieving zero malaria, and that is exactly what our goal at Block Malaria Africa is about. We are focused on ensuring that vulnerable populations, receive, that we amplify the voices of vulnerable population when it comes to malaria elimination. We need to be able to take malaria intervention through medical outreaches, through awareness campaigns, and a whole lot of that down to communities that are mostly affected by malaria. And when we do this, I'm sure that we can be able to make tangible progress.
As we end this conversation today on World Malaria Day, which is happening today, I know you may be wondering, I have this one question for you. What are you doing differently in ending malaria in your community? Personally, for me, I sleep on mosquito nets and I try to ensure that my environment doesn't have water, just to see that mosquitoes don't lay their eggs and all of that. So I'd like to hear from you on the comment section. What are you doing differently in ending malaria in your community? My name is Joey Shekwonujimbo, and to our guest, his name is Odinaka Kingsley Obeta, Ambassador. Yes. So see you on the next one. Bye-bye.